is Gabriella Edwards. I am a third semester nursing student at Los Angeles Southwest College, and today we are going to be talking about diabetes mellitus type 1. So, the major problem with this disease is your beta cells in the pancreas are destroyed. They can be destroyed by an autoimmune disease, viruses, and some of the destruction can be genetic, and some of the causes are just unknown. So, beta cells secrete insulin, and insulin it can be described as the key that unlocks the cells and allows glucose to get in. So, glucose is what the body uses for energy. It comes from two places. It comes from the food we eat and our liver. But remember, when the glucose comes from our liver, it's already broken down into glycogen, which is a ready energy form for the body to use. So when glucose gets in the cell, it's converted to glycogen and then it's used by the body for energy. Um, with diabetes type 1, these people are usually insulin dependent because they don't have beta cells to produce enough insulin and they have to self administer insulin. In type 2, they can use medication or they can use insulin or control it with diet.
Hello, my name is Sunyeme Omorogoma. Today I'm going to be presenting the signs and symptoms of type 1 diabetes. The first sign I will be presenting today is DKA, which is also known as diabetic ketoacidosis. Since there is no insulin in the body starts to burn fat for energy since it cannot get to the glucose. Due to this, the ketones, which are acids, start to enter into the body, and this causes life-threatening situations such as acid-base imbalance, which lead to throwing up. The person will be feeling nauseous and vomiting, especially after eating. They will start experiencing difficulty in breathing, even with little activities. Diabetic ketoacidosis can also cause confusion, extreme sleepiness, as well as sweet smelling or fruity breath. Another sign I'll be talking about is the hyperglycemia. This is when the blood sugar is more than 180 milligram per decimeter, and we usually use the three P's to represent this situation. The first P is polyuria, which is frequent urination. Elevated level of glucose in the body causes the body to remove the water from inside the cell. The water will move in an area of higher concentration, which will be the bloodstream, and this causes more fluid to enter the bloodstream. The kidney will secrete the extra water. However, normally your kidney could have been able to handle this glucose by reabsorption, but there is too much for the kidney to handle, so it leaks into the urine. This will make the patient to start urinating frequently. The next P I will be talking about is polydipsia. This is increased taste. The blood is trying to prevent the body from becoming dehydrated from the excessive urination, so it signals the patient to drink more water, but it doesn't work because the kidney will remove the excess water, thereby making the patient to drink more. This is when they urinate frequently. Polyphagia is the next represent the next P I will be talking about, which is hunger. Before you know it, they start eating frequently. Why? Because the body is burning fat for energy since it does not have any glucose to use. So the body signals the person to keep eating so that there will be food to use for energy.
Okay, so I'm going to go over some of the environmental factors and risk factors for diabetes type 1. Autoimmune reaction is one of the most common factors, and this happens when the immune system mistakenly destroys the insulin-producing cells in the pancreas. Another factor is exposure to viruses. So if a patient is exposed to a certain virus, their likelihood of developing diabetes type 1 increases. Genetics could be a possible cause, and this happens when presence of certain genes indicate an increased risk of type 1 diabetes, or they're linked with the disease. Some risk factors include geography, and it's been noted that people who travel away from the equator tend to have an increased incidence of type 1 diabetes. And Family history is another big factor. So if the patient has a sibling or a parent with type 1 diabetes, they do have slightly increased risk of developing the condition. Okay, so there are several blood tests that can be done to diagnose a child for type 1 diabetes. But first, I want to go over the normal blood glucose levels. And the normal blood glucose levels range anywhere from 70 to 120 milligrams per deciliters. However, for children under 5, they should measure between 80 to 200. For children between the ages of 5 to 11, it should measure anywhere from 70 to 180, and 12 years and older should measure 70 to 150. So the first test is called the random blood sugar test. This is the primary and most common screening test for type 1 diabetes. And it could be taken at any time, and a blood sugar level of 200 milligrams per deciliter suggests the child has diabetes. Another test is the fasting blood sugar test. This sample is taken when the child fasts for 8 hours overnight. The child should have nothing to drink or eat other than water prior to the blood being drawn. Diabetic medication should also be postponed until after the blood is drawn. A blood glucose level of 126 or more is considered diabetic. And the final test is called the hemoglobin A1C. It may also be known as glycated hemoglobin test, and it indicates the child's average blood sugar level for the past 3 months. The expected reference range is from 4% to 5.9%. However, the target level for children 6 years or younger is 7.5 to 8.5%, and less than 8% for children ages 6 to 12. A1C level of 6.5 or higher on 2 separate tests indicates diabetes.
Hi, my name's Sherry, and I'm going to talk a little bit about insulin. In type 1 diabetes, insulin is going to be needed, and they're going to be self-administered injections at least 2 or more times a day. There's rapid-acting insulin, such as Lispro, that needs to be injected within 15 minutes of mealtime. Rapid-acting insulin acts mostly like insulin that's produced in the human pancreas. It quickly drops the blood sugar level and works for a short time. The effects of this typically start working around 5 to 30 minutes and last about 3 to 5 hours. Short-acting insulin, also known as regular insulin, should be injected within 30 to 45 minutes of a meal. It wears off more quickly than long-acting insulin. Usually begins working in 30 minutes and lasts about 4 to 12 hours. Intermediate-acting insulin, such as NPH, and long-acting insulin, such as Detamir, are normally used with rapid-acting insulin to maintain blood glucose levels in between meals and overnight. NPH usually begins working around 60 to 90 minutes and lasts around 14 hours. Common side effects for NPH are low blood sugar. There's also insulin pumps that deliver programmed amounts of insulin on a consistent basis. Okay, so with insulin, you want to make sure to inject the insulin at a 90-degree angle, and it's really important to rotate injection sites regularly in order to not develop hardened areas under the skin. And when you're mixing the rapid and short-acting insulin with longer-acting insulin, you want to draw the short-acting insulin into the syringe first, then you want to draw the long-acting insulin in order to reduce the risk of introducing the long-acting insulin into the vial of the short-acting insulin. And then lastly, you want to store the insulin in a refrigerator in a cool place out of direct sunlight, and make sure not to freeze the insulin.
In general, children with diabetes type 1 need to take their insulin as prescribed. Caution your child against wearing sandals, walking barefoot, or wearing shoes without socks. Meal planning is different for every child, but make sure your child eats regular and does not skip meals. Avoid high fats, high carbohydrates, high sugar food, as well as using artificial sweeteners in moderation. It's important to monitor blood glucose levels daily, especially in the morning before meals. Regular physical exercise is also important, and children who are active in team sports will require a snack 30 minutes prior to activity. Know when to contact healthcare providers, and that's really essential. If your blood glucose is greater than 240 milligrams per deciliter, there are positive ketones in the urine, your child is experiencing disorientation, confusion, or rapid breathing, if vomiting occurs more than once, overall, type 1 diabetes is manageable if you take care of yourself and stay on top of the disease. Thank you for watching.